Good afternoon and welcome to the Caregiver Teleconnection. My name is Glenda Rogers and I'm going to be your facilitator for today's session. Today we're going to be talking about when decisions are left undecided, and none of us want to be in that position, I guarantee you that. So let me tell you just a little bit about our speakers today before they get started. Amelia Card is a second-year Master's of Science in Social Work student at the Steve Hicks School of Social Work. And if you can't tell, that's at UT, University of Texas, because you can see that in her background. She is a 2-year Grace Scholar who completed her first-year internship at Capital City Village and now interns at the Comprehensive Memory Center at UT Dell Medical School. Very prestigious, Amelia. Amelia is committed to working with older adults, especially those with dementia, and their care partners, and has a passion for group interventions that address their unique struggles. In addition to researching fall prevention for people with dementia, she is also currently exploring musical interventions for people with dementia and their care partners. Amelia will be starting as a geriatric care manager at Senior Services of Austin next month. She loves spending time with her fiance, soon to be her husband in October, by the way, her 2 dogs, and a guitar. Jess Ambiee is a licensed clinical social worker at UT Health Austin's Comprehensive Memory Center with mobile clinic for the neurosciences. He is also a part of UT Health Austin's integrated behavioral health care team. He specializes in counseling, grief and loss, and advanced care planning, and he provides support and resources to individuals living with dementia and their families. Additionally, Jess is an assistant professor of practice at the University of Texas at Austin's Steve Hicks School of Social Work. Welcome, both of you.
Thank you.
Thank you, Glenda, for that wonderful introduction of us both. I'm going to go ahead and share my screen, so we can get the presentation started. Can everybody see this screen?
Yes, it looks really good.
Okay, all right. Yeah, so Jess is my internship supervisor, and we talked about what would be a good topic for today. And something that we noticed a lot in the clinic is that when we're doing advanced care planning, sometimes there are things that are left undecided, and that can present challenges to families and the people that we see. So Glenda just gave us a wonderful introduction. So I don't think we need to go over this too much, except that, yes, I am Amelia. Jess, is there anything else that you want to say about yourself?
No, not at all.
Okay. So we'll just talk a little bit about the Comprehensive Memory Center to start off with, which is where I intern and where Jess is employed full-time. So the Comprehensive Memory Center is a part of the MOLVA Clinic for the Neurosciences. We see families, we take a family-based approach and a team-based approach. So our team-based approach is multidisciplinary, meaning that we have several specialists inside the clinic. Those include neurologists. So a neurologist is an MD, a medical doctor, psychologists that conduct testing, cognitive testing. We also have a speech language pathologist that works with some of our patients. We have clinical social workers that work with family care partners and some patients, and we're also involved in research. Also in the clinic, we do evaluations and treatment. So sorry, that's our approach. And then in the clinic, what we do is we do evaluations and treatment. So our main goal is really diagnosis and then follow-up care with family members to help with things like advanced care planning. So diagnosis might include neurological exams, neuropsychological testing, lab work and brain imaging, cognitive communication treatment with our speech language pathologist, and then counseling and education with our clinical social workers. So some of that counseling and education is provided through our caregiver counseling program. The counseling focus is about navigating family relationships, coping with emotional distress, and working to develop stress management strategies for family members. And then we also provide dementia caregiving support. And we just talk about, education around disease progression, dementia communication strategies, challenging behavior responses, and then of course, advanced directives and future planning. And we also assist with community resources. And Jess, do you want to add anything?
Yeah, I mean, so kind of hearing about our clinic and our background, when we're talking about advanced care planning, we're coming from, a place where we have a lot of experience with people with dementia. There may be other medical conditions that, a person may, when we think about advanced care planning, there might be unique parts to that. But yeah, our experience is definitely, within the realm of dementia. And prior to working at the Comprehensive Memory Center, I spent several years working in hospice care.
Okay, so that's kind of the context for where we're coming from so far. And then we're just going to do a brief, kind of like a brief summary of what is advanced care planning. And why we need it. Who needs it? So the what, why, and the who. So what is advanced care planning? And advanced care planning is end-of-life healthcare planning. So it's basically deciding on what you want if you couldn't speak for yourself. It includes advanced directives that Jess will talk a little bit more about later on. But those might be a medical power of attorney, statutory power of attorney, a living will, and a do not resuscitate. Why do we do advanced care planning? Well, it secures that your wants are honored when you can't secure those wants and desires. And also we see that it can really help reduce family stress, especially during a healthcare crisis. And who can do advanced care planning? A lot of people tend to think, oh, well, I'm too young, I don't need this yet. But really anybody over 18 years or older can do advanced care planning at any time.
Yeah, and also to say, I mean, Amelia and I are here based in Texas, and so every state, the advanced directives may, may look a little different, and the names may be a little different. I think our talk about when decisions are left undecided is a broader talk. It's not just focused on specific, what are advanced directives, and there's going to be issues that just being human, everyone's gonna likely deal with in some form.
Yeah, definitely. Thanks for reminding me that we're at a national scale talk right now, so we may have people from all different states. So who doesn't love a quick reality check? This comes from a workbook called Begin the Conversation, which was created by the Lower Cape Fear Life Care organization. They're a nonprofit organization dedicated to providing access and quality life care education and supportive services to patients, families, and communities. And they built a workbook that guides people through making advanced care planning decisions. So the statistics that we're going to see come from that workbook. So 80% of people say they want to die at home. Who doesn't want to die at home? It's the most comfortable place that I experience in my life currently. However, 75% of people do not die at home. And those without advanced care plans may be physically moved up to 3 times in the last few weeks of their life.
I mean, in our clinic, we ask at the very initial visit, we'll ask that question about, if you have a progressive condition, what would your plan be? And most people, probably 80% or more, say they want to stay at home. And then there's all of the practicalities of that, and the kind of the realities of that, and can we do that in this particular situation? So those are kind of some of the questions that come, later on when we're trying to make these decisions.
So next statistic, 21% of people say they don't want to upset their loved one. Who doesn't, who wants to bring up a difficult conversation? However, 53% of people would feel relief if their loved ones began advanced care planning. I know I would love it if my parents would begin some advanced care planning. I've been pushing for it, but they, self-determination. So another thing that's important to note is that from a survey that the conversation, that was in the workbook, 66% of family disputes about aging or end of life issues that end up in court could have been avoided. So this is something that, is sad that can be prevented, but is challenging to get people to start talking about. Anything you want to add, Jess?
No.
Okay. So 60% of people say, oh, I don't want to burden my family with this conversation, when in reality, 56% of people haven't communicated their end of life wishes. So families, people don't want to burden their families, but they struggle to take action because these are difficult conversations to have.
Yeah, and it's sort of like when we think about 80% of people want to age in place, and then 60% don't want to be a burden to their family. So there's all of these, like, how do we construct a situation where we're not a burden to the family, we are living at home, and we do have the supports we need. So those are some of the challenges and in some cases it's just it's almost an impossible situation to kind of have all of those needs met.
Yeah, so when we talk about advanced care planning, it's important to understand the idea of decision-making capacity. Advanced care directives should be completed when a person with cognitive impairment still has decision-making capacity, which is basically the level of judgment and ability needed to sign official documents or make medical and financial decisions. And in our clinic, our medical doctors are typically helping family members understand their loved one's level of capacity. Anything to add for this, Jess?
Yeah, I mean, I think what I often see, like in our clinic, is that when we think of dementia, there's often a lot of gray. And so a person's ability to make their own decisions, just because somebody has like a mild dementia doesn't mean they've lost decision-making capacity. They may still have that. And then kind of determining when, when it comes to their medical decisions, are they still able to, or their financial decisions? That can be more of a gray area that, requires like follow-up from the physician, and the physician has to assess. And when we think about, and I'll speak in Texas, when we think about powers of attorney, and specifically the medical power of attorney, for that to go into effect, we need a letter from a physician in writing saying this person isn't able to make their own decisions. And physicians don't typically, when you make a doctor's appointment and you go in and maybe they're assessing, the person's cognition and their functioning, they usually don't offer a letter like that. They usually say, okay, I don't think he's able to make decisions. Here's a letter. Those appointments can be somewhat short and brief, and they're kind of what you're asking for, what the needs are. They'll address that. They'll send referrals. So if you're sort of thinking, we might be at that point where, my loved one can't make decisions on their own. I would recommend, talking to the physician in advance before the appointment, saying, I'd like you to test his capacity, to see if he's able to make his own medical decisions and financial decisions. And I need a letter, so when you have that letter, that would go with your medical power of attorney, so that, if something happens, and your loved one's in the hospital, you can show not only the power of attorney, but then also this letter saying, you you are you are able to make those decisions on behalf of your loved one.
Okay, and then finally, in Texas, again, we're speaking of just Texas here, the order of decision-making rights. This is from our health and safety code. So if you don't have power of attorney or other directives in place, what happens when somebody can't make a decision and they're in the hospital in times of crisis? Who gets to make these decisions? So in Texas, the order of operations for this is basically a spouse, which is why we can see that marital, legal marriage is important for everybody. An adult child, I have an asterisk there because when the adult child, when this goes into place, it's the assumption that all the adult children are putting this adult child as the decision maker, or deciding this is the person that we can have to make our decisions. If you don't have that, the majority of your children come next, and then your parents, if they're alive still, and then finally, a clearly identified individual or the nearest relative or a member of the clergy, which is something that I learned actually. So yeah, Jess, do you want to add anything to our order of operations here?
Yeah, I mean, and we think about, so, this is like if somebody, doesn't have any advance directives in place, this is the order that they're going to go to kind of get some answers when it comes to decisions, if they don't have that paperwork. So one is when you do assign somebody as your power of attorney, give them a copy of the document so that they have it. So if you're not able to speak, and say what you want or say where your powers of attorney are, they have it and they can come to the hospital and yes, I'm the person. So one, that's important. And two, I can say from like on this side of things, when working with other medical providers, it's sort of like a kind of maybe a common or intuitive thought is like, well, who do I want for my power of attorney? Well, I'm gonna choose my spouse, and that's the closest relationship. I'm gonna choose this person. But the power of attorney gives you the opportunity to pick somebody that may not be in this order, and it may be a friend, it can be when we think about decision making, especially like medical decision making for somebody, it can be a very heightened emotional place to be. And the primary, when you're thinking about assigning a power of attorney, it's, who really knows me, who knows what my wishes are, who have I talked to that, knows me well, that can, in circumstances that we can't predict, would kind of have an understanding of who I am, what I want, and would be able to act this out. Now, sometimes, as a spouse or an adult child, we have our own emotions, we're kind of grieving as well. And so then we're having to, make a decision, and the decision is not really what I want for my loved one, it's what they would want for themselves if they could speak in that situation. And so when we're so close, sometimes that can cloud things, like there can be some fear of losing somebody. And so it's not uncommon, and it's something to really think about, like who would be able to kind of be able to hold their own emotions. And maybe it's a really good friend, that really knows you and understands you and is going to be able to kind of make those decisions on your behalf. And sometimes, I've had folks say that it's a relief not to be assigned as a primary power of attorney, like I'm the spouse, but it's a relief just to be the spouse. So it's something that, you can think about and talk to your family and make sure, others understand why, you've chosen, a certain person. And again, make sure that whoever you put on that form, that they also have a copy so they know.
Yeah, and always know where those copies are. Make sure all your providers have the copy too. Yeah, definitely. Okay, well, we kind of front loaded this with, just like a very brief, quick summary of advanced care, and now, what happens when decisions are left undecided. We've talked a lot about, how to we've touched briefly on how to put things in place, what kind of a couple different kinds of advanced care documents, but what about the limitations around advanced care planning? What are they? And Jess is going to talk about that for us.
And I wanted to, Amelia, could we go back to
Yeah.
slide 9? Slide 9, I think.
Is that a statistic?
I think so.
Okay. Let me see if I can. I don't actually know. Let me count. Hold on.
Okay.
1, 2, 3, 4, 5, 6, 7, 8, 9.
Okay.
Is this it?
Okay. Yeah. That's the one. Yeah.
Okay, great. Okay.
Okay. Yeah, I just wanted to go back. Sorry, sorry, Amelia, about that.
Okay.
I have to go back.
It's all right.
So on the right, 66% of family disputes about aging or end of life issues that end up in court could have been avoided. It's really, I mean, I would say one, it's really, really, really uncommon. It's really, just in my experience, I've been at the Comprehensive Memory Center now 6 years, and it's just very, very rare that something does end up in court, for one. It's not the norm at all. It's very uncommon. But what I will say is, when we think about, our families, the quality of our relationships, they impact how we live and how we're living, and also how we die. So conflict in our families, can include, like, say we have adult children who just do not talk to each other, or do not trust each other, or say a person living with dementia, prior to this diagnosis had a difficult relationship with somebody that turns out to be their primary caregiver, or turns out to be like a secondary caregiver, and maybe the trust isn't there, so it becomes so much harder, to care for somebody. And I think when we think about multiple, when I think about that situation, if there's like multiple family members, multiple children, and there's been conflict, longstanding conflict, this, when each of those parties think about what is it that, my mom would want, and how would they want it, and we're also not talking to each other, so maybe the primary adult child, caregiver is not able to talk, or there's tension, and not able to kind of fill in to everybody the stage of dementia, how progressive it is, what the needs are. And then and then that person may say, well, why are we doing things this way? And it creates a lot more tension, and it can create kind of a being stuck. We've had persons that are, living with dementia, living in their home alone. They, maybe they have a mild dementia, and because of the family, like, difficulty of coming together with a plan, to advance plan. Okay, like, how long, can our mom, stay in the house? What would we see when we need to make a move? Who would she live with? Then we see, like, some unsafe situations happen where somebody is, like, now, like, not really able to cook for themselves or eat for them, to make their meals. Maybe they're getting lost, maybe they're driving still, and there's just not a consensus. So when we think about, so, in these situations, it's really, I mean, sometimes these tensions have been going back for years or decades, and it's not a very simple thing to fix, so if we're in that situation, it's and it's still, say we're still earlier, say there's not, not an issue, like, it might be just knowing that the quality of our relationships do have an impact as we move forward. That's something to kind of, maybe that can bring us together, or meet with a counselor to kind of see if we can find a way to work together. So yeah, I thought maybe we could, so if we move forward, Amelia, to that slide of when decisions are left undecided, I don't know if there's this might be we're gonna kind of go into the meat of this next, but if there's any questions or thoughts that this has brought up.
Okay, let's see what our participants have to say. If you zoomed in, you can raise your hand or you can just unmute your microphone and I'll call on you. If you dialed in on your telephone, you can press *6 and that will unmute your phone. And I will call on you by your area code, unless we have a lot of people with the same area code. And if that's the case, we'll figure it out. All right. The chat box is open also. If you're more comfortable in entering a question or a comment in the chat box, please feel free to do that at any time. Okay, I think people are really processing this, Amelia and Jess. Yeah, a lot of information to think about.
Hi.
Well,
Can I ask
there we
a
go.
question?
Regina, go ahead.
Hi. This may be too soon to ask this question, but my mom has late stage dementia. 10 years ago, she and my dad both did advanced directives, and over the years that she developed dementia, in the early stages, she made it clear very much to all of us that she did not want to live like this. She, encouraged us to do anything we could to not let her live like this. But of course, we've obviously not. So we're getting down to a point now where we see in the next year or so, things are starting to deteriorate. And we're curious as to, can we make changes to what her wishes were in her advance directive, knowing that had she known what was to come when she made her advance directive, we all know she would have not indicated what she did. So
Regina, it sounds kind of what I heard is like in the early stages, she verbalized to you, I don't want to live like this. I don't want to be in this situation. And when she completed her advanced directives, so this was before that early stage, and what did she note in her advanced directive? What was it that she?
Well, I'm not entirely privy to it, but I do believe she noted that if there was a terminal situation, that she did want to receive care, whatever
Okay.
that was specifically, I don't know. So the advanced directive preceded the dementia by 3 or 4 years, by the us noticing the dementia, and also friends of hers, contemporaries of hers, having dementia, and it became a much more apparent situation, but after she did the directive.
Yeah. I mean, that's one of the, these are the challenges with like when we complete advanced directives, we really don't know what kind of situation we'll be in and how that will feel and what we would want. So it sounds like, she here, like the directive of physicians and family, and we could, later pull it up on the screen, but it asks that if you have a terminal condition, where doctors expect you have 6 months of life or less, would you want comfort care, meaning more like kind of hospice or palliative care, or would you want aggressive measures? And so you can put on there, I would want aggressive measures, even if there wasn't, even if we expected these aggressive measures not to cure the condition. And it sounds like, as, in an early stage, she was aware of what was happening. She, received the diagnosis. And we do talk about this a little bit later, but I think your question, at an early stage, she was saying, I know what this feels like. I'm here now. I have this diagnosis. I have more information. And like I said, in an early stage, it doesn't mean you don't have decision-making capacity. So back then, if she decided to update her advanced directives, there's a possibility that she could do that. Like if a doctor said, yes, she can make her own decisions. But since, say those things haven't changed, Now that she's in a late stage, the medical power of attorney, you know, that the reason why we have it is so that we can make decisions with things that, you know, now that we have this information. So she didn't know back then what was going to happen. So yeah, a medical power of attorney can sign a DNR. So like when I was in hospice care, you know, if somebody, you know, was at that end stage of dementia and they didn't have a DNR and they never talked about it, or, you know, or anything like that, then whoever the power of attorney was or the next of kin could sign a DNR, and you know, knowing that this is what she would have wanted if she was able in this space to kind of see where she was, you know. And I think with the additional information of what she was saying in the early stage, like it's definitely you know, it definitely could be amended. I think, you know, I'd be curious, like the language, like, you know, who, Regina, who has like access to that, and maybe kind of look over the document. And but there's, you know, I think it's a challenging situation because, you know, she completed directed to physicians, you know, when she was cognitively intact. But since then, we have some more information, and you know, I think the medical power of attorney can update it.
Okay, so
Update, yeah.
so potentially, my dad, who is still very much aware and alive, and we're all caring for mom in the home, and he could then potentially make that decision, and then subsequent to him, it's my sister who is the first in the power of attorney after my dad. So potentially that might be the way it would go, is one of them could override the advance directive, knowing what we know as of
Yeah,
right now.
knowing that, you know, we have additional information now,
This
and that's
is
why we
Melinda.
have that's why we
Oh.
have a power of attorney. I mean, I think like in Austin here, we have, you know, palliative care that goes to the home, and home settings, and it's for people with late stages of dementia and other conditions. And so those people, they usually kind of initiate a DNR, have those conversations, talk to the husband. So I mean, you know, it's not a black and white situation because she did, you know, kind of write her wishes down. But if she verbalized it to her power of attorney and her family, I mean, I could be very understanding to, like, you know, the power of attorney at this point is the one that can sign a DNR.
Thank you,
Okay,
Regina,
thank
for
you.
that question and for sharing with us your situation. Much appreciated.
Thank you.
Yeah. Melinda was I think there was somebody else that.
Is there someone else that had a question? I see Yerilyn has her phone unmuted. Did you have a question or a comment? She may have just accidentally unmuted.
So yeah, let's go to the next slide. So this is like kind of, to me, this is the meat of our talk, you know, because like sorry, so let me close the door. That's my dog. 1 second. Okay, so like a medical power of attorney, a DNR, a director of physicians, they can answer some broad questions, but there's a lot of questions that they don't answer. And there's a lot of questions that, you know, won't be completed in any kind of document. So, you know, these are, for instance, like, I think the one that I hear the most is how long, you know, when I'm seeing the family caregivers, you know, how long should we try to keep this person at home? You know, there's usually, you know, if we're thinking about dementia and it's progressive and it becomes, you know, where somebody's incontinent and needs, you know, help with toileting and hygiene and, you know, some more physical exertion that maybe even, like, you know, the spouse is having a lot of trouble doing, or it may not be as safe to do. You know, how long should I try to do this. Like, that's not something that, generally we have conversations about, like, we'll say, yes, I want to stay in the home, but, what about our finances? Can, we afford in-home caregivers, 7 days a week, or how often can we afford it? And if we can't afford it, is it, do I want my family to be caring for me, to be helping me with like my basic activities of daily living and going to the bathroom? How comfortable am I with that in the home setting? I want to stay at home, but what does it really look like to stay at home when we have like a late stage dementia? Those are, some questions that are just really hard to answer. I think, another one that is, I think I put it in, yeah. So kind of scrolling down, what is their typical day and quality of life? Is this consistent with their previous preferences? So there was an article in the New York Times about, this woman who was living with dementia, and she was dating this man, and she was in love with him, and they would, go everywhere together. And the children were saying, this is not who my mom would have ever dated. She, if she didn't have dementia, and is this man exploiting her? Like, why, how is this happening? And now that she has dementia, like, so do we honor the person that lived before dementia, or do we honor the person that is now living with dementia? Like, if this is adding to the quality of life, is this something that that we do, or if we're not even sure if this adds or doesn't add? So it's kind of similar to Regina's question of like, before she had this diagnosis, and she may not have thought about dementia in so much detail as she did after the diagnosis, which mother do we kind of honor their preferences for? So yeah, I mean, I think we said that, kind of the next question, kind of going above now, like, how do I balance not wanting to be a burden to my family with my increasing care needs? So, some families, typically staying in an assisted living or memory care will be less expensive than getting like 24/7 home care. With our finances, how comfortable am I, spending down my and my family's resources to kind of stay at home versus, being in an assisted living facility. So those are questions that, often families will find themselves that their loved one did not answer those things in this specificity, when they were able to, and now we're here, and now the families are having to, really try to understand what the person would want, but also knowing dementia, I mean, this is a disease that impacts the entire family. So not only the person living dementia, but also themselves. Like, how do we, come to an answer that kind of meets all of our needs? So, with the statistics that we provided, those are like individualistic questions that we asked one particular person. But when we asked the whole family about, well, what would we do? That's a little bit more challenging. So I was curious if, when we think about, we have these advanced directives, but then there's a lot of decisions that kind of go left undecided. You can put in the chat, if there's other questions that come up, and maybe situations that as a family we haven't talked about now that we're struggling with, like one, like for instance, like if we do decide to, like, for instance, place our husband or wife in a memory care or assisted living, do we decide to move in the assisted living, or move into the independent living side? Do we how often would our loved one want us to visit? Would they want us to visit every day, for hours a day, for years? Or would they want us to visit maybe, a couple times a week to make sure they're okay? And for us to start, kind of, making sure that we're having our own life as well, you know. So, you know, these are the uncertainties that, you know, families are often, there's not usually a clear answer, but yeah, if there's any thoughts on this or any questions or anything that this kind of touches for you, we'd love to hear it.
So you can unmute your phone again or put something in the chat box, raise your hand. *6 if you dialed in on your telephone. I think some of the things that come to mind for me, Jess, is all the statistics that talk about the caregiver, you know, dying before the care recipient, the care partner. And that's,
Yeah.
when you're talking about what are your limitations, that always enters my mind.
Yeah. Yeah, I mean, that's the thing is like this is a condition that can impact the entire family. So it's true that, I mean, the last I heard it, and I've heard different numbers go out, but like 1 in 6 caregivers will die before the person living with dementia. And there's, you know, more than half of caregivers of a person living with dementia have significant, you know, caregiver stress. Over half have, like, you know, anxiety. So there's a lot, and then also being kind of on call or having to always be available 24/7. We're not able to get our own healthcare needs met, you know, go to our own doctor and do our own exercise. And like, you know, the person with dementia, their world is getting smaller and smaller, and their abilities are getting smaller, so they may not be able to do too much. But the person that's the caregiver, you know, their world is very different. And so if they're not exercising, if they're not taking care of themselves, it's going to have an impact. So that's kind of like with these questions, it's like, you know, how do we, you know, with this, you know, the statistics kind of going to the individual as a family, like how do we balance my loved one's needs and also my own needs as a human, you know? It's a little unclear, and I think like Regina was saying, it's I mean, what I would take from what Regina was saying is like before you get a diagnosis of dementia, you don't really know what it's like to live with dementia, and so it's hard for people in advance to say, oh well, I you know, this is what I would want from you as my caregiver. I wouldn't, you know, want to burden you, but this is kind of what yeah, so.
I was having a thought as well, just as you were talking about limitations, and something that I think that I brought up with you since I started at the clinic is like, how do we balance as social workers the right to self-determination with someone whose, you know, decision-making capacity is in decline. And, you know, we always come back to safety. And then it made me think, well, maybe some people's definition of safety might be different depending on family, you know, culturally, and just kind of, you know, level of risk, like level of willingness to take risk. And I think that, you know, as a very early entry level career social worker, my definition of safety is much probably more you know, vigilant than maybe somebody that's been in the field for a long time. But yeah, these are hard questions.
Yeah, I mean, and I mean that brings up another point of if somebody's cognition is, you know, declining and their decision making is declining, and maybe they really can't make their own decisions, and the doctor has said so. But when you talk to them, they say, you know, I don't want to go into assisted living. I want to stay here. And so you know, and they're not able to kind of take in all of the factors that we just said, you know, when it comes to like living at home, then it's a really difficult position to be in, I think, as a family member and to navigate. Okay, well, if we'll go on to the next slide, and if something comes up, you know, please put it in the chat or let us know.
Yeah, so this we found from the Alzheimer's Association end of life decisions brochure, honoring the wishes of a person with Alzheimer's disease, but clearly these can be applied to anybody with a related dementia as well. So, okay, so we've presented all these limitations and advanced care of advanced care. So how do we actually make informed decisions for people, for the people that we're supporting? So the Alzheimer's Association had a couple of ideas. We're curious if you have some more as well, and Jess will go into these a little bit more detailed with some examples. But it's important to focus on the person's wishes. You know, we can stay true to the person's values and beliefs, like we were kind of talking about before, weighing the pros and cons of treatment, and then considering where care will be given. Yeah, so Jess, do you want to talk a little bit about person's wishes?
Yeah, so yeah, and I'm thinking back to like, I'm just thinking back to Regina's question, and you know, it's like her mother years and years ago made this document, but the medical power of attorney form is I mean, it's a living document. I mean, this person can make decisions based on what is happening right here and now. And that's why we appoint a medical power of attorney, because we don't know what situation our body's going to be in. So yeah, I think definitely, I mean, that's why we have that form. And I agree. I think, yeah, definitely talking, you know, to your father, and then if it's like a palliative care outfit that's coming out, or hospice, then they can definitely, you know, get a DNR started. And a DNR requires a physician's signature as well, and the medical power of attorney. So, okay. So how to make informed decisions, focusing on the person's wishes. You know, so like, just to give you an example, you know, sometimes we'll have somebody who's living alone, and their place is, you know, their place is very cluttered. You know, there might be like lots of food left out. They may be eating like a very sparse kind of meals, you know, things that they can kind of make simply. And when, you know, a family member talks to them, they say, this is how I want to live. This is how I want to stay right here. So one of the questions we'll ask to kind of probe is, well, tell me, like, the person that you knew 15 years ago, like that person, if they could see themselves in this situation, what would they want? You know, and just to explore how that, you know, with dementia, the person's decisions and preferences can really change, and kind of understanding like the identity that they had for a really long period of time. If they had those abilities, then you know, what decision would they come to? And that can help us sometimes point to where we need to go. Or if it's something where somebody's in an early stage and they're saying, you know, I really want, you know, to live this way and to do this, you know, kind of understanding that. So so even on like focusing on a person's wishes, making sure that we don't, I mean, it's important to, I think, and that's the thing, the nuance is like kind of what stage that we're in. But if we're in a place where it's clear they have mild cognitive impairment or mild dementia, and they're, you know, telling us what they want, and that can be really helpful to guide us. So staying true to the person's values and beliefs. So that's kind of tied to that, like that person's values and beliefs, you know, 10 years ago, 15 years ago might be different. They may have very different beliefs, you know, presently. So it's sort of, I guess maybe one of the things that drew me to this field is that there is a lot of gray area. There is there is uncertainty. There's not really clear, easy answers. So weighing pros and cons of treatment. So, you know, I think, so if somebody has a late stage dementia and then they find out they have like another diagnosis that requires like an aggressive treatment, and that could, you know, have, you know, months and months of rehab, that their ability to undergo rehab might be really limited, you know, that has to be weighed in on. Anybody that has a late stage of dementia, that's living with the late stage of dementia, we have to kind of factor that in. And a lot of physicians in other fields may not have as much experience with dementia, and they may just say, oh yeah, it's, like we've had patients, they get an eye procedure, and the doctor says, don't, make sure to not to bend over, because that, if you bend over, it could really affect the eye. But a person living with dementia is not going to remember that. And so what are the risks here that if we actually undergo this, the likelihood that they'll not follow the recommendations might be high. And so we have to kind of factor that in. And that's very different. And so also, like, if we have a late stage and there's like something like, say, an aggressive form of cancer, we've had families before kind of take a more palliative approach, because the quality of life and the condition the person's in because of the dementia, to have them undergo like aggressive treatment with cancer just doesn't, it doesn't seem to, they're more focused on a palliative approach, and it would seem to be like too much distress to put somebody under. Now that would be very different if somebody had mild cognitive impairment and had that same, had the same kind of cancer diagnosis. So weighing the pros and cons, talking to your providers, and then if you do have like a memory specialist, anytime there's like a medical procedure, I would check in with your, if you have a memory social worker, a memory physician, just to, get their input on, on what they're recommending on the rehab, and see like what are possible roadblocks or obstacles that maybe we can, get around, or difficulties that we need to address with the treating physician. So, okay, yeah, we can go on to the next slide.
Well, I wanted to add
Yeah.
in, just you and I had talked about apathy a little bit around values and beliefs in people, and something that can come with Alzheimer's disease and other dementias is apathy, which is Jess could give you a better clinical definition of it, but people may not want to be as active. Maybe a person was very active in their earlier life, but they receive a diagnosis, and as they progress, they like lose the desire to be more active. But that there's somebody that likes that enjoys to stay busy and have activities, and so getting them involved in something kind of actually tends to, give them a higher quality of life because of something that they experienced before. So, and I realized too, when I was thinking about that, we haven't really talked about quality of life, and just that goes really with the pros and cons of treatment as well. And what's, when making decisions, just thinking about what's going to be the best quality of life for the person you're supporting, and also, how is this going to affect your quality of life as a caregiver? So that's, then we just have our references.
Good, right on time.
So we can take, I think we could maybe take some questions.
For sure. We have about 5 minutes, or maybe a little more. Does anyone have a question? Excuse me, a comment, want to share your particular situation?
Hello, it's Regina again.
Hi, Regina. Can I just wait just a second, please? You'll see that a
Sure.
survey has popped up there. And so if we would be so grateful if you would take the time as Regina is talking and we're continuing the conversation to fill that out. Okay, go ahead, Regina. Thank you.
So I don't want to be the only person talking, but if there's nobody else that has a question, I just wanted to add something. Earlier, when you were mentioning about making decisions about what kind of care you might want if you were starting on to, if you were thinking you might get dementia at some point, if you were making decisions about home care versus assisted living versus memory care, etc. I just want to flash back to my mom 10 years ago, when there were no overt symptoms of dementia. And none of us, I have 3 siblings and myself, my sisters and I are all in our 60s. My brother is just going to turn 60. None of us really had much experience, say 12 years ago, 15 years ago, with dementia. My mom's best friend, maybe 9 years ago or 8 years ago, developed dementia. We went through the process with the family and only then realized just how, I'm going to use the word devastating it is to the entire family, to everyone. And that's when my mom started realizing how she might not ever want to live like that, because she saw her very best friend living like that. So I guess I'm just making a statement, not necessarily a question, that until you actually experience it through a friend or another loved one, honestly, I would never have had any idea what was to come down the road. So therefore, in making the decisions, as my mom did with her advance directive, 10 years ago, she wasn't in the mind frame that she would have been 2 or 3 years later.
Absolutely. Mm.
Thanks for sharing. I think that when we get more data, we're able to make more informed decisions, and there's just no way to know until we're kind of until we've kind of have some experience with it. So yeah, and then just that context. I mean, I think, yeah, I think it. I think when we think about her advanced directives, I think it kind of it adds that, she's been she was able to see her friend, and she could kind of now better contextualize what she would want. So that's helpful. Okay, Catherine.
Catherine has her hand up. Go ahead, Catherine.
Real quick, I'm in the state of Wisconsin, and from my understanding, there in Texas, you talked about how the spouse and then the children and siblings and such. From my understanding, in the state of Wisconsin, unless you have an advance directive, no one has the opportunity to make choices, and it goes directly to a court. So my question as an elder benefit specialist is helping people prepare. Is there something you can send out as a follow-up, suggestions of ones that are just available that people can fill out to at least get the basics down for people who may find themselves in that situation, whether or not they want to be in that situation?
Wow. 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 Yeah. So, I mean, it sounds like in Wisconsin, it's like really important and significant to get advanced directives done, because it doesn't just here, like working in hospice, a lot of folks didn't have, advanced directives done, and we could just kind of go to the next of kin, and we never had to deal with courts or anything like that. And it sounds like in Wisconsin, it's actually, so it's just a huge challenge if you didn't have that done. Yeah, and every state's different, so that's really, thanks for sharing that.
Yeah, that's a head scratcher, right, Jess?
I mean, that's really something. I mean, we have in Texas, we have the advanced directives link in the form, and we can provide that, but I mean, like in Wisconsin, that it sounds like, yeah, it'd be helpful to maybe have a, I don't know, yeah, to just encourage people there, and I don't know what, exactly where they're stored on the, the Wisconsin advanced directives, but
Well,
that's
if you think of something else, Jess, that you want us to share with our participants on that topic, sort of, you can get it back to Minerva, and we'll get it out to everybody if something comes to mind or whatever.
yeah. Okay, and then Amelia put some in the chat. She put a link to begin the
She
conversation.
did. I had asked her about that workbook that y'all had made reference to, and she has included that in the link there. So if you're interested in the Begin the Conversation workbook, there's how you get to it.
Yeah, and you can download a PDF there as well. It's a pretty long workbook, but if you want to print it, you can print it. It's free.
Oh, thank you so much. We have gone just a couple of minutes past the hour at 1 o'clock here Central Time. I want to take just a second and tell you that we have a couple more sessions in July and August is upon us. So on Tuesday, July the 23rd at 11 o'clock Central Time, Dr. Barry Jacobs, one of our frequent presenters, and I'm a fan of his, is going to be talking about managing caregiver grief during and after caregiving. And then on Thursday, July the 25th at noon Central Time, we have a Spanish language session. You can get more information on that through our customer service representative. I see Melinda has her hand up.
Okay, I figured out how to unmute. Are you able to hear me?
Yes.
All
yeah.
right. Thank you very much for this important information. I had to log off for a minute, but I do appreciate you all sharing the information. I work actually for Area Agency on Aging and in Texas, and we are able to help individuals prepare advance directives. We partner with the Texas Legal Services Center to do that. And in each state, there may be area agencies on aging that can do that also. So just wanted to share that. Thank you.
Thank you, Melinda. Coming from an area agency on aging myself, I appreciate that plug for them. They are a well-hidden resource for sure.
That's a lot of times what I'll say during a presentation.
Yes, absolutely. Thank you for bringing that up.
Thank you.
Well, Jess and Amelia, do y'all have any final words for our participants today before we close?
Thank you for joining us. I hope it was helpful and maybe, a little thought-provoking, for you and helps your decision-making moving forward.
Thank you, Jess. Amelia?
I would just say, thank you very much. And also, as Jess emphasized a couple times, it is a gray area, and these are decisions that take time. And take time and have compassion for yourself. And that's it.
Okay. Thank you so much for joining us today, Jess and Amelia. We appreciate the information you've shared with us today. And thank you, everybody that is in a caregiving role, either professional or family caregiver, for all that you do. It is appreciated. I hope to see you on future sessions. But for now, bye-bye.